CBC machine. Here at our clinic we have the Abaxis VetScan HM5. So general maintenance for it is always making sure that the area is completely clean and, dusting off, cleaning the outside of it at all times. Just general maintenance of that. Some of the other more daily things is every morning we'll always run a blank, just to make sure that the machine has a clean slate before starting our day. Other things that you can do is every now and then you can run controls. Those can be purchased and they are just run through the machine, just so that the machine has a calibrated normal level basis to make sure that we're not not going off on any crazy thing. You can get normals, highs, and lows. We have normals just to keep that. You also will have to do kind of more of you'll do cleaning. Well, every now and then it'll come up with a warning that'll say that you'll need to do some wash head cleaning. The way that you do that is you'll open this door and this area right here, this little head right here, make sure there's no buildup or any nastiness or from blood, any buildup or anything like that. You'll just take a little gentle, gauze or a chem wipe, things like that, and just wipe that down. And every now and then it'll require more deeper cleaning where, that's where the HEMA Clean comes in. It is a cleaning solution that is run through our system like a blood sample would be. We also have our reagent pack where all the different liquids are kept, and once that gets low you will need to rechange that and make sure everything is clean and free of any debris or anything like that, and make sure there's no kinks in the tubes or anything like that, and once it's low you will replenish it and things like that. Alright, so now I'm going to perform my ELISA serological test. At our clinic we have the VetScan View, which uses these different card test kits that test for so these are for the antibodies for different diseases such as Ehrlichia, parvo, heartworm, different things like that. So today I'm going to be doing an Ehrlichia test. With these you can either use whole blood, Peppernice whole blood, or you can use serum. Today I'm going to go ahead and use some serum, and all you need is 1 drop. So I'm just going to grab this. And with this card, like I said, all you need is just 1 drop of serum or whole blood to fill up the reservoir and make sure it is saturated. So each test kit comes with a buffer, an assay buffer that for each specific test. So this one is my buffer for the Ehrlichia test, and it says on here, it will list on here that I need 3 drops of this. So just going to do 1, 2, 3, and then you just stick the card into the view analyzer, and then with the tablet or phone, whichever one you have, you'll enter, you'll do a time scan, and you'll enter the patient name. So for this patient, enter the patient name, and this runs for 10 minutes, and after the 10 minutes, it'll pop up with the result whether the test was negative or positive. So the modified Knots test is used to test for microfilaria in the blood after a positive heartworm antigen test. You can also use a direct smear just by placing a drop of blood on a microscope slide, but it will be stationary so you can see them. So what you're going to need is 9 to 10 milliliters of 2% formalin and 1 milliliter of anticoagulated blood. And in a 15 ml centrifuge tube, you're going to mix the 1 milliliter of blood and also definitely make sure to wear gloves during this since you are handling formalin. once you have that, you will add, I already have my 2% formalin ready, and you're just going to mix it with the blood. Alright, so once that is mixed, you're going to centrifuge it for 5 minutes. So I pulled our tube out of the centrifuge. It ran for 5 minutes. And so next you're going to discard the supernane, which I'm going to do off camera real quick. You want to make sure not to get rid of the sediment. And then you're going to take some methylene blue and get a drop into the tube with your plug. And then you're going to mix that together. And then you're going to take a drop of this and place it onto your slide. And then put your cover slip over it. And like I said before, it's going to be different than your direct smear because the microfilaria that you're looking for are going to be stationary instead of wiggling around. So you're going to take it over to your microscope. And then check for any microfilaria. I am not seeing any, so I am confident that this dog does not have heartworms. Okay, I'm going to go over the different fecal testing methods. There's a fecal flotation with centrifuge, direct smear, and sedimentation. The first one's going to be the fecal flotation, and you're going to start off with about 2 gram fecal sample, and I'm going to mix it with our ova flotation solution. Mix that together, and then after mixing off, yeah, she wanted to help apparently. Alright, so after that you are going to take some gauze, cheesecloth, whatever you guys have at the clinic, and you're just going to strain it, getting out all the big chunks. So once you have done that, I'm going to go ahead and pour this into our test tube. And if you don't have enough, you can add some more flotation, but I happen to have enough. And you want to get it to where you have a meniscus or a little bubble so that you can go ahead and put your cover slip on top. And you're going to let that sit for about 10 to 15 minutes, and then you can put it on your microscope slide and see what's under the microscope. Alright, for the fecal flotation with the centrifuge, you're going to take another 2 gram sample. And then you're going to mix in your ova flotation. Take your gauze or whatever you choose to use and strain the pieces out. And then you're going to fill up your centrifuge tube. This one you're not going to fill up all the way because you are going to centrifuge it. So I'm going to leave about a little bit like that from the top, and then we're going to centrifuge it, and then we'll get it set up. Alright, we've taken our tube out of the centrifuge, and you can see all the sediment is now down at the bottom. So we are just going to fill the rest up with our fecal flotation to where we have a meniscus at the top. And then we're going to take the cover slip and set it on top and wait 10 to 15 minutes and look at it under the microscope. Okay, for the direct smear, you're going to get your microscope slide, and you're going to add a couple drops of saline or flotation solution. And then you're going to take a small bit of the fecal matter, and you're just going to mix it in with the saline or the solution, being careful not to get any too big of chunks or anything like that. So once you've done that, you can then put your cover slip on top, and then you will go ahead and take it and look under the microscope. So for the sedimentation, you're going to take a cup full of just regular tap water. You're going to get a 2-gram sample again. You're going to mix that with the tap water. And once you do that, you're going to take your gauze and strain out the excess. And then you're going to take that and put that in the centrifuge tube. Careful not to fill it up all the way. And you'll take that and you'll put it in the centrifuge for about 5 minutes. Alright, so I took this out of the centrifuge, and we have the sediment down at the bottom. You're just going to pour off the supernatant, just leaving this sediment. So you can take a loop, a pipette, whatever, and you'll take the top layer of the sediment and put it on a microscope. We'll go ahead and use it. We'll take our cover slip, put that on top, and then we will look for, and we will look through that under the microscope. Sedimentation is really good, mostly used with large animals because their eggs are usually too heavy to float to the top with the flotation solution. So we use this one in order to see any eggs that could be present in the fecal matter. So when we have a patient in the clinic that's presented with ear problems, they'll usually say things like their head's shaking, they're scratching a lot at their ears. Usually you'll notice some debris, that brown gunk that everyone talks about. Sometimes you'll notice a very distinct smell. The doctor will want to normally do an ear cytology. So when you do those, you'll need sterile swabs, and you'll want to grab samples from both ears. So we'll start with his right ear, making sure to get down into starting into the canal, getting any debris if you see it. So got a pretty good sample there. And then we'll go to the other ear, even if there is not, just so that we can have a comparison. So still looks like we'll have some, and then we'll go ahead and break the end off for the left, just so that we know which ear is which. So now that we have our swabs, we're gonna get our sample onto the slide. So you're gonna take your right sample and do it onto the right side of the slide. You're just gonna be careful to kind of roll it around just smear it kind of all over, getting a good amount onto the slide. And then you're going to take the left one and do it on the left side of the slide. Just making sure to get as much as possible. And then you can heat fix it if you want. It's up to you. And then you're going to go ahead and stain it. And by staining it, you're going to be able to see any bacteria that could be present in the ears. Alright, and with this one, since it is kind of a loose material, you want to be super careful not to wash off any of the ear matter. Alright, I'm just going to dab it off, dab the water real quick. Make sure it's nice and dry. Okay, and then you're going to go ahead and take your slide over to the microscope. You're going to start on the 10 power. Good spot that you want to get an eye on. Then you're going to go to the 40 power. Then you're going to do an oil immersion, so you'll go in between, you're going to get your drop of mineral oil. Alright, and then you go to your 100 power, and like I said, we're looking for any bacteria or any other things like that. So I am seeing a couple of cocci, so we'll go ahead and I'll go ahead and let the doctor know, and we'll probably treat his ear infection. So we are going to be doing a fungal test on this patient today. Normally when you do fungal testing, we have, normally notice some sort of lesion or skin irritation that presents itself as fungal. May do some bacteria testing as well, just to rule out, just so that we know which medication to use. Today I have a enriched dermatophyte medium with me, and we're gonna be running this test today to test for things like ringworm and things like that. So from him, I'm gonna need a couple of hairs. You want to make sure that you have all parts of the hair, because the bottom part is what we're gonna be needing. So, alright, buddy. I know, good boy. Alright, and so I just need to pull this back. And then I'm just going to place these hairs on the medium. And reseal. And with this one, it won't be an immediate result. We will have to let this incubate in a dark area for a few days. And then we'll see if he has it or not. So a lot of times we'll have patients come in for skin problems, variety of different things, rashes, different lesions, you know, problems, things like that. So a lot of times you'll have specific spots where the area's having trouble. So you'll want to go ahead and do a skin scraping just to see exactly what is going on that's causing the problems. Is it just allergies, or is there another problem such as bacteria, fungal, mites? Mites are super common, as we all know. So for the skin scraping, you're going to want to have your dog restrained, and I've already got a slide ready with mineral oil and a sterile scalpel in order to scrape the skin with. So I'm going to go ahead and scrape her underneath her armpit, just where she's been having some hair loss. So when you scrape, you're going to want to scrape pretty hard to where you'll, in order to draw a little bit of capillary blood. We got our some hair and some skin cells in there, and you're just going to want to get that all into that mineral oil. And then you'll get a cover slide over that. And then you're just going to look under the microscope. Looking for any evidence of mites or I am not seeing any. So I will turn that information over to the doctor. So we are going to be doing a necropsy on this brat today. I have everything set up for Dr. Turner. We have a suture pack available, and we're going to be using a scalpel today, just a 10 blade. I have our jar set up with our formalin ready to go for any samples that he needs to send off.
All right. Well, first of all, I would start out with a history, just like with any physical exam, with any illness. It would be nice to have the history of this animal and any symptoms that it might be showing in clinical signs. And then I would look at this animal like I would do a physical exam, just like a live physical exam would look. Just be methodical about it so we don't miss anything. Start at one end and work our way through organ systems, or work our way from front to back, however we normally would do that on the live animal, to make sure that, because we're gonna contaminate the outside with the inside, so we need to make sure we look at it at the outside first, so we don't damage or destroy any evidence that we might have. Next, I would start the necropsy by making an incision. You want to be very careful and not get too, be very careful so we don't destroy evidence. You never know what you're going to run into that might be the clue you need to help decide what caused this animal's death. So you can do this with scissors, or with, you can do this with scissors, or the scalpel, whichever you would like to do it with. I don't usually remove the skin from the entire animal unless something on the outside warrants that. Then I'd enter the abdominal cavity. I already started that a little bit. And before you move things around, disrupt them too much, just kind of get a peek for where, kind of get an idea of where the organs are. If there's, is there free blood in the abdominal cavity, or bile, or is it distended with fluid? Just kind of get an idea of what's in the abdomen before we start manipulating things too much. One thing that's good to do at this point is make sure you don't just enter the thorax without first coming through the abdomen and observing the diaphragm. Thorax are not lifted, so that's a big deal. So at this point you can go ahead and move on into the thorax, or you can treat the thorax and the abdomen separately. So I'm going to go on this small animal like this. You could probably just split the sternum and open it up enough. Another thing that helps this rat, again, is cool enough. I'm not too worried about it, but sometimes with it, like a dog, if you cut in the axilla like that, sometimes these legs want to stay up here and they get in your way, and the animal wants to flop around. You can also do it in the inguinal area too, or in the inguinal area. It'll help lay flatter, so you're not fighting it constantly. So I'm going to go ahead and we'll save that thorax. So just again, be methodical. I would probably start with the liver, dissecting or looking at the liver as a whole. It's going to make sure it's laying where it should be. With all these abdominal organs, you want to look at their color and their normal texture, their normal surface. Is it glistening, or is it discolored, or is it bumpy, is it rough? And so look at them as a whole before we start, because they damage you too much. So I would probably remove this liver, get it out of the way. And also, it's a good idea to don't just throw these away, because we're going to need to section these in a little bit and take samples. So I would lay that aside. Next, just work through the organ systems and look at kidneys. There's a kidney. Make sure, again, is this no normal size? It is many times, especially pathologists, they would probably weigh each organ and make a note of that. It's difficult to have a standard size because animals are so many different sizes. But you definitely want to inspect them and make sure if that organ looks an appropriate size for this size of animal. But what normally you would do is start in the stomach. go through and look at the ingesta, see if there's any clues or what it might have been eating, and follow it on through from the stomach on into the pylorus, into the small intestine, and open, I don't know if you want me to do all this or not, but open the entire length of the intestine to stretch it out. Again, all the while we're doing this, we want to know, are these structures an appropriate color? And open it. We're looking for any obstructions, anything that looks like a tumor, parasites. Some parasites you're going to be able to see just with the naked eye. So, and then follow that all the way out till the GI tract exits the body. And then with each section of the GI tract, whichever species you are dealing with, you'll want to take sections of each of those and put them in formalin. Move on up to the thorax. Now, like I said, we could split the thorax right up the sternum and probably be fine on this little guy. Sometimes it's helpful. Sometimes it's helpful to go ahead and remove like the whole ventral section just so you can see a little bit better. In the throat region, I would look for, you would get thyroid, parathyroid glands, lymph nodes, whichever you felt like you needed to sample. So we'll enter the thorax. Sometimes you can cut ribs, and it'll let the thoracic wall lay down a bit easier. You would look at this. It's not real clear in this one, but you would also look at the lung tissue. That's probably what I would look at first, and see. Is it nice, pink, pliable, healthy, or is it dark, bloodshot looking, dark purple? Keep in mind that not everything you see is pathology. That side that's laying down, if the animal's laying down, it'll look congested. Mm-hmm. So you would also, and this guy's pretty small to see this, but you would open the trachea and follow the main stem bronchi down into each lung and follow those. Mainly, you can see, like you may find heartworms. Mm-hmm. There are a lot of foreign bodies, there are a lot of things you would be looking for going down the trachea. So the heart, again, this guy's small to do, but the heart, you would go through each chamber. Like I would start with the aorta, or the vena cava, and follow it into each chamber of the heart, and look for any pale areas, any discoloration in the heart muscle. Again, this from the freezing, this has changed some, but just follow the normal path of blood flow through the heart, through the whole system. Again, looking for any abnormalities there. So you can see a little bit of the demarcation there. That's pretty pink lung tissue, and then that red is pretty congested. We wouldn't necessarily sample every muscle, but if there's an area that's looks abnormal to you, you would want to address that. Normally, I wouldn't. You don't get pathologists sampling like the tongue or the eye necessarily. It really depends. A lot of times, if you could go through and sample everything, but you have to look at cost as well, and somebody's paying for this, and you know, they're going to send all those samples in. So another thing that sometimes you'll need, you'll want brain tissue. What you can do on a larger animal than this, you need like a saw to run that samples. So go through your gross necropsy and do again whatever was warranted with that procedure. Then when it comes, don't have a cutting board here, but scalpels aren't the best instruments to use for actually submitting the samples. You don't want like lots of little choppy cuts. You want a nice, clean, long cut. And that's where necropsy knives, which are basically butcher knives, work best, especially with an animal bigger than this. You don't, you know, if there's you want to send normal looking tissue, but also, you know, if the liver looks like 3 different tissues, we'll send a sample of all each piece. And you want to also label pretty well. They're going to be able to tell, but it's best to label. So you could take a section like this lung. You could take a section that a lot of times if you get the junction of a normal and an abnormal area, that's helpful for a pathologist. And you don't want to make, you want to make specimens, you want to give them enough that they can make their section, but you don't need to send half a liver. And so you can put each organ in a separate container. Again, if the heart looks basically normal, you don't have to send multiple sections. You want to make a small enough section that the formalin will penetrate, because we don't want it degrading on us before the pathologist gets it, before the formalin has a chance to set it. So, I think that's enough example on that. Okay, so you would just go through that and take each of your mainly internal organs, go through and sample each of those, make sure they're well labeled, and make sure each of the containers are labeled with all the information for you know, the client, the animal's name, or some kind of identification, and probably the clinic would be good as well.
All right, thank you, Dr. Turner. I'll go ahead and label these with the name, the date, the organ that we took the sample from, and we'll go ahead and send them off to the lab, and we'll see what's going on with this little rat. When dealing with a rabies suspect case, only certain personnel can, there are certain safety precautions that you need to take in order to go about things correctly. Only vaccinated doctors and technicians are allowed to handle the suspect patient. You need all personnel that are handling the body need to wear protective eyewear, gloves, and a face mask. And I work in the state of Arkansas, and the health department supplies our containers for sending off our specimens. The specimen required needs to be the decapitated subject. You'll need to put the specimen in a bag in air-sealed, watertight container, and you'll need to put that surrounded in ice into the provided bucket. The bucket is very airtight, safe, water safe, and that is put into a box that will be sent to the health department for testing. And once that is done, once you're finished getting your specimen, the rest of the body is to be cremated. Alright, I'm going to be doing a vaginal cytology on this patient. First, what you're going to do is make sure that the whole area is very clean. I have some chlorhexidine gauze with right now. Just want to wash the area as best as possible. Make sure that we don't have any contamination or any other bacteria. And so it's best, and we'll make sure the tail does not fall back under. I'm just going to moisten the end with some sterile saline. And this is a sterile gauze. So what you're going to do is you're going to, thank you, you're going to hold down, pull down on the vulva, and you're just going to insert it horizontally and then straight up. And you're just going to kind of roll it around in there just to get a good sample. Okay, now that I've got my swab, you're going to immediately get your slide and roll. Just roll it onto the slide. Careful not to rub or anything like that. So you're just going to roll it over, getting all of the cells onto your slide. And I'm going to go ahead and heat fix this slide. Just very quickly running it under. And then you're going to go ahead and stain it. So you're just going to rinse it with distilled water. And let it sit and wait and dry, or you can go ahead and dab it. Careful not to break it. Alright, once it's dry, you can go ahead and look at it under the microscope. Looking at the different cells. So from looking at the different cells, most of what I can see is a more of the intermediate and the squamous epithelial cells, so not seeing a whole lot of cornification. So I would go ahead and say that this dog is an anestrus. So the 4 different stages of estrus in female dogs are anestrus, proestrus, estrus, and diestrus. So for anestrus, you're going to mostly be the intermediate and parabasal cells. You won't see any, outwardly changes. The dog is just kind of normal. And then for proestrus, you'll still have the intermediate parabasal cells. But you'll start to notice an increase of the superficial cells. This is when the dog is starting to be attracted to the male. You'll notice some seroneous discharge, the vulva being swollen. There's an increase in estrogen, and the uterus is enlarging. And the next part is estrus, where the female will actually stand for the male. At this point, the microscopically it'll just be all cornified squamous cells. You'll probably see maybe a little bit of red blood cells. And this is when, like I said, the female will stand for the male, probably still having some discharge and some swelling. After that will be the diestrus, and this looks very similar to the anestrus. There is a significant decrease in the superficial cells, but they're starting to increase the intermediate and peribasal cells. So microscopically, it's hard to kind of tell the difference between that and anestrus, and there will be no real outward. She'll no longer stand for the male, but there won't be any obvious observations to show that she is an estrus. Today I'm going to be performing a cross-matching agglutination test. We have our donor and our recipient. I've already pulled blood from them both, and I centrifuged a serum separator, and I've already taken the serum from both and labeled our vials with our recipient and our donor. So I'm going to set those aside for a second. And I also took 2 EDTA tubes from both of them, and they have already been centrifuged where they have both been centrifuged, so we have the packed red blood cells at the bottom. So the first thing I'm going to do is take the plasma from both of the tubes and decant both of those off. Alright, so all that we have left now is the packed red blood cells, and I'm going to take 2 drops of each and put them into a clean test tube labeled with, the recipient. I already have them labeled, and they're clean test tubes. So I'm going to take 2 drops per patient. This is our recipient. Two from our donor. And I already have 3 mils of saline pulled up, and I'm going to mix that in each tube with the packed red blood cells. So we have our donor. And our recipient. So once that is done, they're going to look a little bit like that. You just want to mix them around a little bit just to get it really mixed. And then I'm going to centrifuge this for 3 minutes just to get all the red blood cells back to the bottom. Alright, so these have been centrifuged, and the packed red cells are back at the bottom. So next you're going to decant the supernatant again and get rid of that and just back to the bottom of the packed red blood cells. And then I'm going to repeat the wash 2 more times. Alright, so now I've finished our 3rd and final wash, and our erythrocytes are good and washed now. So I'm going to decant the supernatant the 3rd time. so now that we're just back to our packed red blood cells, I am going to make an erythrocyte suspension for both the donor and the recipient. I have these still labeled as the recipient and the donor, and so I have 0.98 milliliters of saline. So I'm going to start with the recipient and fill that up with the 0.98 milliliters. And then I'm going to take 0.2 milliliters, 0.02 milliliters of the packed red blood cells. And put that in my suspension. And I'm going to repeat that for the donor. And now I have my 2 erythrocyte suspensions all ready to go. So now we are going to make our major cross match and our minor cross match. So for the major, you're going to take 2 drops of the recipient serum and 2 drops of the donor suspension. So let's see. Got the recipient serum. 1, 2. And then donor suspension. 1, 2. And you're just going to mix those together. There's a major cross match. And for the minor, you're going to take 2 drops of the donor serum and 2 drops of the recipient suspension. Together, so we have the minor cross match, and then you're going to want to do controls for both the donor and the recipient. So you're just going to take the donors, so you're going to take the recipient. So for this one we're doing the recipient control. We have the recipient serum and the recipient suspension. Same thing, 2 drops, 1, 2, and then for the suspension, 1, 2. All right, and so we have the control for the recipient, and then we're going to do the control for the donor. So I have the donor serum, and then the donor suspension. 1, 2. 1, 2. All right. So now we have our major cross match, we have our minor cross match, and then our control for the recipient and the control for the donor. So now that I have these, we're going to let these sit for 30 minutes, and then after that we are going to centrifuge these all together before we take a look for any agglutination. Alright, so we let our major and minor cross matches and our controls sit for 30 minutes, and then we centrifuge them for 2. I'm going to take a quick look at them. I do possibly see some minor agglutination, but of course you can't really tell until you look under a microscope. So I'm going to go ahead and get a drop of each. And put it on a slide. Cover slip on both of them. And we'll go take a look underneath the microscope. We'll go ahead and take a look at the major crossmatch first. I am actually not seeing any agglutination. Everything looks great on this one. And take a look at the minor. And same thing, everything looks great. So we can go ahead and safely say that these 2 dogs are a match, and we can go ahead and get some blood from the donor and give it to the recipient and hopefully get her feeling better.